officers, one civil for our work, but there was a warrant for one of the people that was staying there as well. So yeah, I mean, let's see. I think I let, this is Commissioner Vetch's district, so I let him know. I think one of the issues is they're now just continuing to, this is from Friday, acquire new household garbage and putting it under the porch. And then just covering it so we don't see it, but that's not, I mean, that's in a garbage can. It's not an enclosed container. It doesn't meet I wouldn't file a human health hazard, I'm sorry, that's my previous ordinance. I wouldn't call this a public health nuisance at this point. Obviously, it's a couple bags of garbage, but I think it's evidence of repeated behavior, right? So I'm not sure if this, just going out and cleaning it up will resolve the issue because there's still people staying there. So it may be that Ned and I are going to be dealing with this for a while.
Sarah? You mentioned the tax and trying to get money back that way. Is there an update? Are they behind on their taxes or what the status of that is? Do we know?
She said no.
Not when I looked them up in
Okay.
Beacon.
Okay.
So,
Mr. Chair.
Yes, Commissioner Lyon.
Greg, you can probably help us out on this one, but it looks like they've been doing some work on the building. Did they pull permits for that? I see that the siding is off on the one side that looks like facing the lake, or I don't know if, and then there's those risers out there. I don't know if they're looking at, if they were planning on adding on or putting up a porch or what the deal was. But that last picture Sarah had, it almost looks like the foundation's not real stable
No,
either.
it doesn't look very.
So I'm just kind of curious if for the improvements, if they pulled a permit on it.
So Commissioner, the last thing in the city view records for the property was a contract for deed in 2006 from the father to the son. Nothing since then.
we were told that there used to be a porch there by neighbors. So it's not a planned structure, it's something that used to be there.
Oh, okay. Because I would assume, and I don't know what it's like on the inside, but there's tarps on top. My guess is the inside's got to be dangerous too, especially if they don't have functioning water. If they don't have functioning water, my guess is the sewer system isn't working either, or the septic system.
So the initial complaint we received in planning and zoning had to do specifically with the septic system. And two of our septic representatives visited the site with me early March and ultimately weren't able to see any evidence of anything failing. But the presumption is without the running water, they can't run the septic system. So thus they're carrying their waste out. I did show the pictures to our building inspector, a building official, and I think ultimately before we would go down any of those paths, we would need to first leverage local resources through the township to assess the condition of the property as to whether or not it's a safety threat.
Now, when was the contract for deed?
2006,
Did we have the,
the family exemption.
no, well, that, and then, but there was still a requirement after so many years, they still had to update the septic system if it was out of compliance, wasn't it?
Well, yeah, so the septic system, I asked that question specifically. We ultimately would have inspected at property transfer under normal circumstances, but because that happened in 2006, it predated the elimination of the family exemption, so there was no call to inspect that system. So it's basically grandfathered.
Okay.
In 2011, that loophole was eliminated, so now if there were a contract for deed between even family members, we would have to inspect. But there was no trigger for that, so it hadn't been inspected. To my understanding, it's a septic drain field. There is no holding tank that precedes the drain field, so it's
So it's very old, it would never comply.
correct. Yes, sir.
But we can still, if it's still non-compliant today, we can still force them to update the septic system, can't we?
I think well, I'd defer to Mr. Kreiser on that question, but I believe it would be a property transfer that would drive that process.
There are, Mr. Chair, Commissioner Dahl-Leiden, there are different ways that we can get at looking at that septic system. here today, I'm not sure of the facts of how this came to our attention. I mean, is it an imminent health risk is my concern? I don't know here today. So if it is an imminent health risk, we can start moving on a little bit faster. But if there's no water going into it, then
Yeah.
there's not much of a health risk.
Mr. Chair,
Yes, Commissioner Vetch.
so you mentioned that there is some assistance that you're looking for through the township. Have we articulated what our expectations or what we would need from them at this time?
Well, so I apologize if I misphrased that, Commissioner. So ultimately, I think before we would go out with our building official and inspectors, we would first defer to the township to assess whether or not the structure was in need of additional consideration as to whether or not it was a threat, a health risk. I think that would precede our pursuing that from the county's perspective, county level first.
I think you mean safety risk.
Yeah,
This is
safety
where we
risk,
get,
correct.
yeah.
So the request right now is for abatement enforcement by the county. Is that
I think
correct?
we're a little bit stuck on this one.
Yeah.
I would not call it a health nuisance because they removed the open garbage and debris. However, I will tell you, the landowners the neighbors are incredibly frustrated because they did the minimum. Now, I think in the future, we would probably start parallel processes, but I have not quite encountered a situation like this before, where they met one letter of the law, and since although it said remove all the garbage, they only focused on that portion of it and did not just clean up the entire yard. So the concerns now are about blowing trash, things getting in the lake, wildlife, and again, it's a public health nuisance. We're worried about the concerns to the neighbors and the general environment of the people who live around the property, not the wildlife and other pollutants, which that's what makes it more of a MPCA and planning and zoning township issue.
Mr. Chair,
So if the township requests that for the county planning and zoning to look into it because they believe that the property is a safety issue to the general public, then at that point, it wouldn't be public health, it would be planning and zoning then that would look at it from a structural standpoint?
Yes.
Structural and environmental.
Yes, there is, you have ordinance that covers
Yeah.
open debris.
So from the building perspective, we would look at it from the structural perspective for, a health risk or a safety risk. From the planning and zoning perspective, we would look at it from the refuse and debris perspective.
Okay.
And that,
Mr. Chair? Oh.
yeah. Commissioner, Haslam, go ahead.
Yeah, I mean, to me, it seems like the septic system is a big issue because when we moved, our septic system was fine, but it was older, so we had to replace it, we had to upgrade it. And if you've got a non-working septic system and you've got people residing in there that, it's either you don't have one or you have a working one. So I guess that's what I'm kind of wondering about here. And I mean, we had another property that, in another township, and the people were just basically camping there, and there again, they didn't have running water, they didn't have a septic system, they just moved on, after their house burned down, they just camped there, essentially. So that's what I'm kind of wondering, that if they're residing there, I don't know if you can require that they have running water, probably not, but it seems like you've got to go somewhere, and if they don't want you going out of the woods. So that to me is sort of a health issue. But
And Sarah, I think it'd be an easier decision for us today if that picture with all the garbage was the way it looked today.
Oh, absolutely.
And now I think we're separating that, and I'm leaning more toward the planning and zoning part. The sheetrock and construction material just doesn't seem to meet the same level, as you said, as the garbage part. The structure looks like our building officials, you can legally walk around and in plain view see some things that might draw your attention. I don't think we have the evidence on the sewer thing. It's like suspicion. Unless the law says we can bust in there and see where the waste is going. If you're not seeing a trail of it going out the door or bubbling up somewhere, I don't know how much we can really dig into the septic system, because you don't have to have running water. There isn't any law like that, and there isn't a law about hauling your waste or doing something else with it, because we don't know what they're doing with it. So I think we're kind of back to your refuse in the area and the structure itself without more information. I mean, we all have good intentions about, hey, this doesn't seem right or look right, but I don't know in the eyes of the law if we can do much more than the planning and zoning side right now.
Mr. Chair, that's the exact issue I'm seeing here. Normally what we have is we have a sale of a property, and that triggers a compliance requirement or inspection requirement. And it's an inspection requirement that is usually what we end up enforcing. And we make people go on and get it certified. And when they fail, then they fall underneath the second step, which is a 1-year replacement provision. And then when they don't replace it in a year, then we go after replacing it for them. So we aren't even to the point where I can require them to get an inspection that I'm aware of.
You know, my concern is that with the tarps up on the roof, that I would think that there's, and again, I think you had said that one other time that if there's mold on the inside, that really doesn't condemn the building, though. I mean, there's no law on that, right?
Well, so we generally, my line is that we say it's unfit for human habitation, and that's generally for people who can't decide where they live, children, vulnerable adults, also in some instances, like animals and like for domestic cats and dogs, that people might keep them in unsafe places. But they're not children, they're not vulnerable adults involved. These are grown adults making decisions for themselves, so they can live in that environment. Whether that building is safe or not and structurally sound, I can't attest to that. That is outside of my scope of practice.
Hey, Greg, is there anything we can do if it's not structural sound?
Yes, Mr. Chair, there is under Minnesota Statute, Chapter 463. You declare it a hazardous building abatement. The county's practice in that is to refer it over to the township.
Okay.
Our building official usually does the inspection, and then the townships follow through on the process of issuing the resolution and eventually raising the building.
Okay, so at this point, I'll make a motion that it just get deferred to the township at this point and bring it back at some other point, or however is the best way to go.
So sorry.
Motion made by Commissioner Dryden,
I'll second that.
second by Commissioner Houston. Further discussion?
Mr. Chair,
Yes, Commissioner Vetch.
just clarity. So at this point right now, you're looking for a request back at Clearwater Township to request to the county planning and zoning to want us to do a site inspection for structural concerns of the property.
At this point, it has to go to the township because we cannot, the way it looks, say that it's a nuisance or public nuisance ordinance via public health. So that's our only option, is to refer to the township for them to decide what they want to do. Whether that's referred or not, it's up to them.
Any further discussion?
Mr. Chair,
Commissioner Winter?
only one thought. Okay, you said it's a drainage tile as far as the septic that they have. And since there's no water there, but they're getting water from the neighbors, and I don't know how much or where it's going, if they just toss it out the door or what. And then we all know that certain items don't all go in a bag and get tossed out either. So I'm kind of wondering how far that is from the lake, because there's rules there.
Well, we don't know if they have a compost toilet or any of that sort of stuff, so we're speculating right now.
Oh, that's true too. I didn't think of that, yeah.
And the feedback can go to the concerned neighbors too. Are there any here, by the way?
I don't think they were able to make today, but they were notified of this meeting.
Okay, just wanted to
Okay.
ask in case they had wanted to say anything. But information can be relayed to them, that if they have further information to relate to the right folks and they snap a picture of it or whatever they do legally without getting into a confrontation, that we can take another look if the circumstances change. But the way we see it today and look at it, this is the best we can do. Any further discussion then? If not, all those in favor of that recommendation or motion to go back to the township for their review, say aye.
Aye.
Aye. Those opposed? Okay, motion carries unanimous.
Thank you.
Thank you.
Okay. All right. Next is set committee of the whole meeting for truancy discussion.
I think Michelle is here, but I don't know that we need you to, we're just asking that we have a truancy discussion at some future dated committee of the whole. We would ask that court services and county attorney be present at this committee of the whole to participate in the discussion.
Mr. Chair?
Yes, Commissioner Delay.
I remember when this came up the last time, I thought you wanted to get together with those other two to get your plan together and how you want to present. Has that been done yet, or do we need a month, 2 months before we do this committee of the
So-
whole?
Right, so there were two pieces. One is that we were sending out a survey to the schools. We have a draft format that's gone to the county attorney's office. Actually, Jessica and I are meeting this afternoon to do a second iteration of that. And our hope, we've shared this information with the Safe School meetings, that the survey will be coming out. Expect it, we want your feedback. So we're trying to pare it down to just really keep it simple, but yet get information that is helpful. And we've told schools we want to get it out to them in the next couple of weeks. Really, we'd like to get it out by the end of this week if we could, just knowing that school schedules are very busy already.
And I think the all-school schedule, if I heard at the Howard Lake Safe Schools, was going to be maybe the first part of August. So
The 10th
July
through
might
the
be a little
17th.
late because I think we'd want to get whatever we want to enact together between the committee of the whole, going to board, and then the Safe School meeting.
Right, and it really is it's HHS and the county attorney's office.
Along with the feedback you're hoping to get from the survey before the meeting, right?
Correct.
Okay, so I guess you're running the survey, and what would you suggest for a date for starters that we?
Middle
A
of-
later Wednesday in June? I don't have my calendar in front of me. Amy, is there a,
Maybe, is there like the third week in June?
22nd?
I have a child graduating, so that last week of June is, if we could avoid that, that would be great.
did you say the 22nd is a Wednesday? If that's,
It is.
Can we avoid the 22nd?
Okay.
Thank you.
What's-
I would like to
How
avoid
about the
that.
that's not the last
21st?
week.
21st after the board meeting?
Are they, fine with me?
I don't know if we got workshop or what we
June
got.
21st, HHS has an all-staff for June 21st
Oh, okay.
until 3:30.
23rd, Thursday?
Prefer to avoid the 22nd through 24th.
I'll come in for that.
Avoid that rest of that week, Greg says.
What about the 20th?
20th of Monday?
You have EDA that morning at 8:30. Could do it after that.
Okay. What are we thinking for EDA time? An hour?
8:30 in the morning, I'd say give yourself
10 o'clock?
90 minutes just a buffer, it's safe, so
10?
10 o'clock
10:30?
would be fine.
10 should be safe.
Oh, 10, yeah, that'd be
10
2
should be
hours.
good.
10 on
Well, it'd be
the
an hour and a half.
20th of June?
Sure.
It's either that or we can all come to your house for the graduation
Graduation
party.
party.
Sure.
Okay, is there a motion for committee of the whole meeting at 10 o'clock on June 20th
So
to
moved.
discuss truancy?
Second.
Okay, motion made and seconded. Any further discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion carries unanimous. All right. Next, we have approved request to apply for continuation of the Family Planning Special Projects Grant 5-year cycle through MDH for period 2023-11 to 12/31/2027 with Sarah.
And board, I have Sarah and Kelsey here to walk you through this grant process.
Okay. There we go.
Okay, so I am here to talk about the Family Planning Special Projects grant application that we are hoping to push through. The grant runs through from January 1st of 2023 through December 31st of 2027. So here's a little bit of the grant overview. MDH has been awarded over $12 million for the first 2 years of the 2023 through 2027 grant cycle to provide pre-pregnancy family planning services to populations at greatest risk for unintended pregnancy, often because of lack of access. So the RFP will award grants in the 8 regions of Minnesota, and again, the grant period will run from January 1st of 2023 through December 31st of 2027. The application is due on June 10th of this year. And it's a non-supplanting grant requiring an expansion of services or new programs. So the purpose of the family planning grant is there are 6 different components that it asks us to kind of make a work plan about. So the first one is public information, and what we've done in the past is this is when we give the information out to the general public. So a lot of times it's through media outlets or like just mass media outlets. The second component is the outreach and education. So this is when we actually focus on those specific populations at risk and we inform them about the program. The third component is counseling and pregnancy testing. So with this, we invite the clients to have a meeting with us, figure out what their needs are. It can be as simple as like a well women's check or STD, STI prevention and treatment. It can be family planning methods in general. Whatever they're really looking for, we look to see if it fits with the family planning, what we're supposed to be doing. And then if we can't, we refer them on. If we can service them, then we move on to the next section, which is the family planning method provision through contracts that we have with community clinics. So contracts we currently have are through Stellis, and we are in the works of contracting with Alina in the Cokato and Annandale area. We also contract with pharmacies to prescribe any medications for treatment or methods. Then the last 2 are referrals and follow-ups. So there are certain things that we can't provide through family planning services. Some examples of that are we don't do HIV treatment. We can't do abortion services. We can't do any services for unemancipated minors in a school building. So any of those situations, we would refer out to a different agency that can provide those, and that wouldn't be part of this grant. And then
I was gonna say, you mentioned at-risk population. Who is the at-risk population that you're serving?
so the at-risk population we're serving includes people who are uninsured, underinsured, don't want their policyholder to know that they're receiving care. That's pretty much the gamut. Anyone who applies, we just put them through the criteria. And then, as I was saying, then we follow up with the appointments that we do make with our contracted clinics. We have been receiving this grant since 1986, and currently we do provide all 6 of the family planning components. Some of the goals we have for our next grant cycle are to increase awareness of family planning and Minnesota Family Planning Program, MFPP, in Wright County. We would like to reduce unintended pregnancy and STIs through education on responsible sexual behavior and family planning choices, as well as promoting family planning and MFPP services. We'd like to provide comprehensive counseling to enable clients to make informed decisions about their family planning choices, promote healthy relationships, and reduce risky behaviors. And then also to promote family planning methods in service to the targeted population. Some of the successes that we've had in the past in our past grant period, specifically from 2018 to 2022, our outreach statistics were negatively impacted by COVID-19 restrictions, but we were able to make 1,649 contacts during the grant year of 2020 to 2021. We did 22 outreach events. 1,032 people were counseled on medical methods of birth control from 2017 to 2021. We had the integration and coordination of family planning into other public health and human services programs to provide the continuity of care and support the follow-up. We collaborate with the clinic at the Wright County Jail to cover family planning and STI-related service costs for people who are incarcerated. We have a program called Project for Teens. It's an event within the school district where we train student leaders to teach other students about STI prevention and healthy relationships. We also have sex trafficking and sexually exploited youth efforts aimed at promoting healthy relationships and preventing trafficking and exploitation. And then we hand out who you're gonna call cards with updated information throughout Wright County. So it has family planning information, but it also has a lot of resources for various things throughout Wright County. The last thing I wanna say is that this is estimated that taxpayers save an average of $7.09 for every public health dollar that is spent. Any questions?
Sarah, and we talked last week, and I talked with Jamie about the grant that I think is worth about $1 million of services.
About 1.3 over
Right.
5 years.
And so in looking, you were gonna check to see if we didn't want to accept part of the service and the money, if you could do that, or is it an all or nothing to get the grant?
So, well, I would add that we're in an open RFP process. So a state agency is not going to tell us yay or nay about whether or not our application will be competitive or not. They can't put themselves in that kind of position with an open RFP. However, we had a conversation this morning, or Kelsey did, with the grant officer. And to be clear, the contraception itself, that cost is tied directly to the counseling, which is the staff cost. So if we don't provide the method, we also don't have a need for the counseling, which eliminates the cost, the grant. We would be basically paying for brochures and outreach efforts, which is not what the grant is written for.
Okay, well, if it can't be separated, then I'll just be on the record saying because of religious views, I'm not gonna support it because of the contraceptive part. And that's why I wanted to make sure that we cleared it up, that can you separate it and still get part? If you can't, then, you know, I won't be able to support that. But that was my only question, so thank you.
We appreciate that. I was talking with Kelsey and Sarah earlier today, and when Kelsey said that our numbers of contacts that we made were negatively impacted because of COVID-19, because, you know, we weren't providing the services because public health is otherwise directed. Our teen pregnancy rates did go up, and our STI, our sexually transmitted disease rates did go up in Wright County. So I feel very comfortable and recommend that we proceed with this grant process, just because I think it is in the benefit of our citizens.
Mr. Chair.
Yes, Commissioner Deline.
I was going to bring up about the teen pregnancies, because I know we were trending down dramatically for many years. So that's kind of curious that since we weren't able to do the job, teen pregnancies did go up. Numbers, 5, 10?
Trending up, I don't have a
number.
You know, we were asking, I think we were going to reach out to PSOP, but I don't think that has happened yet. It's a little bit difficult because some of them are still pregnant. We get numbers very late. It's easier to track through social services.
And Mr. Chair, I understand, since I'm of the same religion that you are, but not everybody is. And since this is not just preventing pregnancy, it's also preventing STSs, and it's an educational thing so that One, I don't know if one of the things you talk about is abstinence, so, which you guys do. So it's not just about condoms and that sort of stuff, it's complete education. So,
That is one of the requirements of the family planning grant is if we're giving the counseling, we have to give the counseling on everything. And whether we provide the service within public health or we refer it out is part of what we do, but we have to say it, we have to tell everything.
okay, good.
Mr. Chair, I'm going to make a motion to approve the request to apply for the continuation of family planning special projects grant.
I'll second it.
Motion made and seconded. Any further discussion? If not, all those in favor say aye.
Aye.
Opposed? Aye. Motion carries 4-1.
Thank you.
Okay. Next is,
Thank you,
Yep.
Board. We're getting into a little bit of the fun area, I think, of our agenda today. So I'd like to, I think we're at this point, aren't we? I'm going to have Anna and Jessica come up. They have some
Okay.
information regarding our Diversity, Equity, and Inclusion Committee, along with our ER Committee, which is our Employee Relations Committee. And they would like to share some information about that. Jessica asked me, do we have to be real formal? And I said, well, don't be no, you don't have to be real formal. We want to get a good feel for what this information is. And I believe you should have a handout in your packet, just for the little bit of historical perspective. We have a Wright County Health and Human Services Agency job description with the purpose of our Employee Relations Committee. Prior Director Don Melezva, I believe he started this, the earliest date I have on here is January 1995, but I think it actually preceded that date, that there's been an ER committee as part of HHS for a number of decades already. And with that, I'd like to turn it over to Anna and Jessica, if you'd like to introduce yourselves.
and just a second, Jamie, did you have a document maybe to post? Because I didn't find one. I wasn't looking for one because it
Yeah.
didn't show an attachment.
I didn't see
Didn't
any
either.
attachment
Do you have
either.
one to maybe put up on a,
I don't know how to do that.
just to follow along or not?
You know where this is? Could you tell me where it is?
Should be where?
And the invite?
Like here?
The invite?
Oh,
Am I gonna push this? No, not that. I'm stepping away from the,
Oh, this
from the
is
podium.
intense.
Zoom in on the
Yeah, that's not working. There we go.
Yeah, don't show my notes. I got my jokes in here.
you got to test out all the technology.
There we go.
Wow.
All right.
Go ahead, Jessica.
Okay, well, my name is Jessica Shaughnessy. I have worked here at Wright County for about 6 years now. I work in child protection, so it's pretty fun.
I'm Anna Radloff. I am a therapist with our licensing and therapeutic services team.
But we're going to talk about, or I'm going to be talking about ER committee. So ER is Employee Relations Committee, and what we do is we bring the county together, Health and Human Services together, and help address anything that we need to address, complaints regarding how we dress, or bathroom smells and stuff like that. So, so we address that.
It's an unusual example to use. But
I know that was the only thing that came up. So we do that, and that we do that through the suggestion box, and anyone could put suggestions in there, and we address them as much as we can. And then we also do all staff. We have an all staff training day coming up in June here, and we're going to be addressing self-care, back pain, because when you're typing, your back is hunched. So we're going to be addressing that, and how to care for our back, and then peer support. The work that we do here at Wright County Health and Human Services is hard work. So we are going to be reaching our hands out for each other and try to support each other the best that we can, especially with the time of COVID. I'm sure things have been more complicated and more stressful. So we're going to be doing training on that as well. So the ER committee has subgroups such as SAG and PERC, but recently we just merged it together. It's called Staff Participating in Activities Related in Kindness.
Spark.
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 So that group, we do popcorn days. We do random activities such as, I think we did costume parties during Halloween. We do contests just to bring everyone together in a personal level. And our goal is to relate to one another. Supervisors and employees here at Wright County, we don't want it to be a different level. We want to be all together, come together as one, because that's how it should be. Wright County is a Wright County to work at, and we want it to be home because it is our second home. We spend most of our time here. I know sometimes I spend 10 hours here because I'm doing other things. So we want it to be personal, we want it to be home, and we want to bring everyone together. So that's our goal.
It's a great goal.
Alongside with that, recently, we had decided to develop a diversity, inclusion, and equity committee, and that was out of a common interest of enhancing our diverse experiences by highlighting, educating, and recognizing diversity on all levels. High levels would include common associates of diversity, gender, race, those things, but also less recognized but equally significant aspects, socioeconomic status, education, family systems, those things. Our goal is to foster and honor diversity within our peers, peer-to-peer relationships and connection, but also to help us better serve our growing diverse population in Wright County. Another goal is just to have a fun, all-inclusive work environment. So we do that through various activities. Some of them are educational and informative, and some of them are celebratory and competitive. So recently, Jessica and I had decided to gain some more awareness to our diversity committee. We would do a mock Summer Olympics.
Yeah.
We'll call it. And so her and I raced. I represented Liberia, and she represented Vietnam, and Liberia took home the gold, so I will let that know. We raced about a 150, 200 meters, but Vietnam did take home the walking, fast-paced walking relay, so we evened it out. We also did, in December, we recognized, I think, 10-plus different holidays associated within kind of that time frame, and that was really fun. We also last week did a Cinco de Mayo celebration, and we had walking tacos. That was a big hit. We've received a lot of positive feedback from our peers and a lot of interest in joining the committee as well. So,
Anybody up here get a walking taco?
there was just a small little invite list.
Oh, okay. I'm just kind of curious.
Yeah, next time we will be more inclusive. Ironically.
There's a good one.
But our goal is to continue to grow countywide, just so that we can enhance the inclusion and diversity aspect on a larger scale.
And board, just so you know that both of the diversity, equity, inclusion and ER is employee run. The ER committee started out being a forum for management and, line staff to get together, and it really was not a very fun time to be had. The people were really complaining about all manner of things. The loudspeaker's too loud, I can't hear the loudspeaker, it's cold when the door opens, any kind of thing. But I think the group really it's evolved to something that I think really elevates all of our staff and everybody, it's not just those kind of complaint issues. I think it's really evolved into something that's much more feasible for us to be able to work together. And again, I just commend staff because this is really what they're doing, they see the gaps that we need to be providing. So, and I know it's an informational item, but I would welcome it if the staff could, if you have a support motion or something for this activity to continue.
So right now you got it just in your department, but you're looking potentially to expand it to across the whole
Well, I'm
county?
not looking to expand it, but I would also support the county to expand something like this. Right now, I am just bringing forward the fact that this has been going on for a number of years. I think it's probably been, when I say under the radar, not that it's not transparent, but it has not gone out to the rest of the county. But if the board supports HHS continuing in this vein, I think it would be great to have that as a vote.
Well, a lot of the comforts that you didn't have at the old building, a lot of that must have got taken off the table. when
Well, we
you
had
moved in.
we had two committees before for, again, it's an umbrella committee under the ER committee, which is now the Spark committee that kind of does the fun activities like at turkey time, Thanksgiving time, they might do something related to Thanksgiving and those kinds of things. So now we have one committee. So yes, it's really brought our agency together, having all of our staff together. This is just one area that I see this as a big benefit.
Mr. Chair.
Yes, Commissioner Delayden.
Well, I think it should be countywide since inclusion is an important aspect of it. But, you know, we have the Wellness Committee, and I don't know if either of you, I don't think I've seen either of you sitting on the Wellness Committee. But really, I think one person from your group should be on the Wellness Committee, and one person from the Wellness Committee should be on your group, so that you can work together and not duplicate any efforts. Or
We have reached out to the Wellness Committee on several occasions. I think there was a mental health, last year we had something, program for mental health, so we brought them in to see, you know, like, so we do reach out to the Wellness Committee as well. But yeah, maybe we could figure something out where somebody on the ER committee sits on the Wellness Committee.
yeah, I'm
Maybe
just
they do, I
thinking,
don't know.
because one of the things right now is that they're going to be doing a survey, I believe the Wellness is, regarding food, what to bring in here and trucks. So
We have opinions about everything.
I know, I'm sure you do. I've only dealt with you for 9 years. So I personally, I think it's a good program. And I'd like to see you be able to expand it throughout the county. And I think working with the Wellness Committee, I think you guys could eliminate some duplications and actually be able to do more things.
Yeah, I agree.
And where is the suggestion box?
So what happens with the suggestion box, it's an electronic suggestion box. HHS has had one for a long time. The county did implement one. I think Mark was maybe spearheading that a number of years ago. So what happens with the ER committee is when I get all of our suggestions, I will bring them to the ER committee. Because, you know, I can answer a suggestion box, but I don't have input, you know, that's why they're anonymous. People don't want to come up and talk about it necessarily. So I'll bring the suggestions in and kind of have an open discussion with the ER committee, and they say, well, maybe this is this, or I think this is maybe where the person's coming from. And then it gives me more information about how to respond.
Now, in the past, they have shared that with us, and I think I haven't seen any sharing in a while, but I think a lot of the
Everything's so
problems.
good, we don't have to, no, I'm kidding.
Well, like, I'm thinking the problems went away when this building was being designed. So everybody was happy again.
I will say I did strategically not do the suggestion box for the few months before we moved, because that means I do not have to respond to a number of suggestions that were in there already. But there will be one upcoming very soon here.
And Mr. Chair,
Yes, Commissioner Hewson.
one way to help your back is for all of us to use that little button on our desk, right? So we can raise it up and stand periodically, so.
How come they didn't give us one?
We got one.
Oh, really?
Yep.
On the left side, far left side of your desk, there's some buttons
I
there.
think mine's on my far right. I don't know, it doesn't matter, but.
Mine's on my left.
So we just wanted to share this information with you, and I think our staff are doing a stellar job in kind of trying to keep the morale and everything up, working now, especially now that we're all together.
Yeah, I
It
think.
might be a
yeah.
topic for a leadership meeting, see if your other office and department heads would be on board with. I can think of some more or less likely to want to wear a mask or a full costume on Halloween around here.
Mr.
Yeah, we
Chair,
might be outed now with
Yeah.
some of the things we do, because we'll be in full public view
Right,
now.
yep.
We're not over at the HSC and on the third floor any longer.
Commissioner Vetch?
Mr. Chair, I'll make a motion in support of their efforts and to continue their efforts under the pretenses that we just discussed.
Okay,
I'll second that, and maybe to expand the efforts, with outreach and that kind of thing. Yeah.
Motion made and seconded. Any further discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion carries.
Mr.
Thank you
Chair.
very
Yes,
much.
Commissioner Lyon.
One thing we failed to tell them, though, is that this has to be done on Saturdays and Sundays and evenings, right?
Weekends and holidays. All right, thank you. Next is presentation of the 2021 HHS Annual Report.
Yes, thank you, Board, and I'll wait for it to get keyed up here on our monitors. I'm always happy and excited to present our annual report. This you'll have, I think you have a digital copy, maybe you have a paper copy. This is something that's already on our website. However, we've not shared it with our partners yet, and looking for any information or input that you may have. Here it comes. So we have had our internal team has worked on this. We just do this in-house. I believe annual report is required of HHS in some obscure statute. I don't know what it is. But in any event, we like to take this time to kind of tout the work that we've done in the past year. So here it is. I think we'll go right ahead to the next page. It was kind of fun writing the executive summary for this year. One more page. We did a little retrospective here of when we first separated Health and Human Services from the third floor and over at the HSC. So you'll see from those 20-some intervening years what some key components look like back in 1999 versus 2021. You'll see basically in that time, actually if you go to the very bottom of those, our revenues and expenses basically doubled. You'll see some other interesting tidbits of information and the picture of our two different WOW vans. I think there was another WOW van in the middle of those, that big, huge WOW van. So that is that piece. It's opening backwards for me. We have the summary, which shows where we fit within the state of Minnesota for a lot of thresholds. We also, you'll see, because this has become a digitized document, we are including some links in there. We were at the Health and Human Services Board meeting a couple of months ago and shared with you our Health and Human Services scorecard, the public scorecard, which is now part of this document as well. You'll see that Wright County exceeded DHS thresholds for 9 out of 10 performance measures in 2021. One area that we didn't exceed the threshold, we had an exception from the state because of the situation was out of our control. So we have no PIPs required, no performance improvement plans required from the state for those 10 specific areas. And some of the numbers are fairly, pretty dramatic. I think we did a very good job in 2021 keeping things moving along during the pandemic. The next page is just our strategic imperatives, which we just like to get it out there as much as we can. And
We're having technical difficulties.
yeah, we are. And my staple, it's not even non-technical difficulties because my staple's in the wrong spot, so I have to keep.
You just didn't want to open that document.
Do you have it on, do you have a link to it yourselves or not?
I'm using a paper copy.
Okay. Page 5 of the report talks about the COVID-19 vaccine report, and basically you should have a graphic there that shows the total dosage administered by Wright County Public Health in each of about a dozen local cities.
So Jamie, the total people that got the shot in Wright County through public health is 17,325.
In 2021, yes.
But do we know how many people got it other places and what that figure would look like? or
That's
not?
why I pointed out to Sarah and Kelsey that they might have some other questions to answer. I think we know about okay.
And that other 25%, is that township residents maybe, or,
So
because this shows the cities?
total doses administered by Routt County Public Health. Other would be people who aren't from our county.
Maybe you want to move it to the next page.
Yeah.
Okay,
And
because
after that.
I thought maybe that's township folks, because townships aren't
And one more.
listed.
It may be. So I need to look it up, but I'm happy to pull up how many people were vaccinated that reported Wright County as their county of residence. But that's easy enough to look up. But what is the question? So
Who
these
the
are,
other is.
yeah, so the other is anybody who came from anywhere else. It's not just townships. It'd be townships if they didn't fit into the city category, but it would also be if they came from another county, they came from another state. Some people were, like if they're a snowbird, technically their address is Florida or wherever they snowbirdie. So,
Okay.
I know there's cases where adult children had them here with their parent and vice versa, so, yep. Thank you. The next area is our financial report. The one data point that I always like to point out, and we've been between the 3rd and 5th, I think, for a number of years, but Wright County ranks 4th lowest per capita in total costs in Minnesota. And if you look at the little geographic map there, so in essence, it means in 2021, it cost each resident $1,617 to have social services and financial services provided to them. If you look to the county directly to our, gosh, I'm not good with directions, to our east, Hennepin County, it costs each of their residents about double that to provide the services. So I think we provide our residents with a very cost-effective and quality services. You'll see the other counties that are around us as well depicted there. And then our numbers are really behind, so this is even though it says 2019 community-directed expenditures, we have not received our cost report from the state but it's always 2 years behind. So when we say there's $224 million that were community-directed expenditures from Wright County Health and Human Services, that doesn't mean that money all came through our agency. It means that we directed services out in the agency and were paid for through HHS. So you'll see that depiction there, that the majority of those services were health and medical assistance at $128 million for our residents. Followed by developmental disability waivers, adult waivers, children's services, and then some other ones listed there as well. That graph is depicted in the thousands. Okay, again, I'm struggling. Our financial report on the next page shows what our public health expenditures are. Again, those were not recorded under the cost report that you saw earlier. And then on the right-hand side of that page, we have the Wright County Health and Human Services levy percentage. It increased 0.4% over the prior year. Looks like 0.4, Chris.
Yep.
0.4.
0.4.
Yep. So here we're just trying to catch kind of the big nuggets for the board and for the public in our annual report. And then the rest of it are just nice pictures. You'll see that we have our structure, our governance structure, our HHS organization, some committees that we have that stem from HHS, some of which we talked about today, and then along with our supervisors and our management staff. So I'm just providing and giving the board you this annual report with the intention that this be made public. As I said, it's currently on our website. And if you have constituents or other partners that we work with that you would like to share it with, we can either provide you with paper copies or the link for you to share it with people that you work with as well.
Mr. Chair, I'll make a motion to formally adopt the annual report or receive the annual report for publishing.
I'll second that.
Okay, motion made and seconded. Any further discussion? If not, all those in favor say aye. Aye. Opposed? Motion carries unanimous.
Thank you.
Thank you.
Thank you.
Then we have the 2022 first quarter financial report from Christine.
So anticipatory while we wait for the stuff to come up on the screen.
Alrighty, I'm gonna just segue back to a couple of topics earlier. The suggestion box is accessible by all county staff, both on the main RightNet page and then for Health and Human Services. Where do I find page? It's got to make a suggestion. And the next step is you select the departments, and that's what routes it either to our team or other county departments. Okay, so you have in front of you today the first quarter financial statements for Health and Human Services. Our revenues are at 12%, which is about the same as last year. Our expenses are at 23%. It's a little bit higher than last year's percentage. Mainly in that category, you'll see administrative costs are at 32% compared to 22%. Which is, we'd like to see things at about 25% since we're 1/4 of the way through the year. Taking a look at the detail on that, our building rental not only increased for the cost of the new building, but it's about $6,000 higher than what we've budgeted. So Ryan and I have been going back and forth. We were provided 1 square footage for the budget. They were provided a different square footage for the actual expense. So we're in the process of sorting that piece out.
Christine, just to that point, because we talked about recently at some meetings about building rental, what are the 1 or 2 costs you were given per square foot?
We are being charged $19.60 per square foot. That part stayed the same. For budget, we were told it was 61,000 square feet. And what our monthly cost that's being charged is over 64,000. So with 3,000 more square feet, it's about $6,000 more per month that we're getting charged.
Economic development area that originally was in our area.
Yeah, Ryan and I have been going back and forth today once I found it, so I haven't been able to sort it out.
Okay, thank you.
Just for your idea, Commissioner Ketchmark, for this, it doesn't really count anything. I mean, it's just in, out, it's paperwork. But the advantage is that we use these numbers for reimbursements from the state and federals. So if it's a legitimate number, it actually benefits us.
Okay, thanks.
Also in that administrative line is the equipment 6480 is higher, and that's because we've purchased a number of our computers that are scheduled for reimbursement or scheduled for replacement in the front part of the year. But we also purchased a couple of larger equipment items, the larger play station that's located in our lobby, and a larger safe for the front desk area. So that's why that particular line item is higher than where we would expect it at this time of the year. And then there's also a transfer that wasn't budgeted from public health to the capital improvements for the UCare Dental Clinic. We received the grant money and we've just been transferring that to the capital improvement funds as that project has gone through. The other thing that I just took a look at quickly before I move to the graphs is our personnel costs. Hiring is still a challenge right now. Just with the first quarter, we're $763,000 below our anticipated budget at this point in time. Any other questions on pieces that are in here before I transition to the graphs?
I got questions on page 5 and 6, but I don't know if that's related to the graphs or something else.
Okay.
Page 5 of 40, that's the way it's on my printed copy here.
Yep.
But as far as the mobile home taxes toward the top there, it shows what you collected, but then there's nothing budgeted. Once you have a figure close to if everybody paid on the mobile home, what that figure would be?
So the direction from Lindsay last year was for us to not budget for those particular lines.
Okay, any reason or background that you know of, or?
If she told me, I've forgotten.
Okay, I'm just asking, because someone must have a count for mobile homes in the county, and, you know, they all owe something, then what would that total be? But,
Yeah, so in the past, we had done an average of what we'd received in the prior years, and she had just let me know that we don't need to budget for that, so I did leave it blank.
okay,
Did
well,
you-
I could follow up with her then.
Okay, did you want to follow up? Otherwise, I'll see her next, so I can ask too.
Well, whoever gets to her first, how's that?
Okay.
And then on page 6, next page towards the bottom, salary overtime, 8,000 looks like spent and none budgeted. And I was looking at other departments and offices, what they do, a lot of them do budget some for overtime. Do you typically not, or?
We do not, because we don't really have any scheduled overtime. But what ends up happening with the overtime is that we're not spending it on either full-time or part-time personnel because of vacancies. And I think,
And that was a direction change a number of years ago, where we used to budget for overtime, and then we stopped a number of years ago.
It was because you weren't using the overtime.
yeah.
But
And-
right now, in the situation with short employees,
Right, we have.
not much choice you have.
Kim's area, I think she's down 6 to 8 people in one division, so.
Yeah, that's because of Kim.
That's
think
all I had right off.
in a normal year, our overtime costs are not as high as what you've seen the last couple of years with the COVID response. That's been our significant areas. Social services does tend to have overtime just with call-outs and things like that that aren't necessarily planned as well.
Okay. That's really as far as I had time to get through the 40-page report, so I'll address something with you in the future if I have something, if that's all right. Okay, thank you.
Okay, so the first graph we'll take a look at is going to be the income maintenance random moment time study. You'll see that the revenue is just a little bit shy of our budget for, our quarterly budget for this particular year. Part of that has to do with their expenses, which are just one graph below. You can see the expenses are down quite a bit from the prior quarter. The last report we received is based off of Q4, and the revenue that you'll see if you look at the details farther down is that our staff time is largely focused on SNAP and food support. Kim is anticipating in the future that will shift back to medical assistance, which tends to have a slightly higher reimbursement rate if it's under the enhanced rate. Any questions on income maintenance? Next, we have social services. Their revenue is quite a bit down from where we would hope to see it for first quarter, about 62,000. This is the one where the reimbursement rate has dropped after some training that was done in April of 2020. So right now it's hovering at about 15.4. There's not really a lot that we can do on that. In a lot of areas, we're trending at the same as the other counties that are in the statewide pool. The revenue or the expenses that we report are pretty much staying the same. So the slight drop in revenue is related to the expenses. Any questions on that one? Then we have our targeted case management. Right now, it looks like it's about 22,000 under budget, but the good news on this one is that the staff, the fiscal team completed a rebill of about 60,000. So what you're looking at right now, add another 60,000 to that, and that brings us up over where we would anticipate the budget to be. Questions on that one? Next, we have our waiver revenue. You can see that that one right now is just a little bit below the target for the quarter. The staff percentage goal that we've set is 63%, and for the most part, on a month-by-month basis, they are exceeding that budget. They're just not, or that goal, they're just not hitting it as high as they were earlier in 2021. That one, we saw some percentages as high as 77%.
Is that baseline based on that 63%?
Yes, the budget is based on 63%. The one factor that the budget doesn't take into consideration is staff vacancies, because if you have a person that's not working, they're not going to be able to bill for revenue, and they wouldn't be reflected on the 63%.
You'd be happy to know that 2 of our new staff are waiver staff, right, sitting right here.
Christine, can I just add, and these are staff number 5 and number 6 of the last 6 months, so that's a significant reason for the decline, is that we've had 6 new staff, so that training time for them and the training time for their trainers is not billable, and then also our waiver numbers, as you know, not being able to contract out cases, our numbers of cases have gone up significantly, and each case has unbillable time. So that's
Jill, I thought you said we were hiring smart people that didn't need any training.
very little, very little.
Oh, okay. See, those people that live in the Wright County are smarter than those that are out of.
Hey, come on.
Okay, any other questions on waiver? No. Next, we have public health revenues. You'll see public health revenues are quite a bit below their target, and what this shows is that we've added targets to many of the different categories. Public health, we just added it for first quarter. They did not have targets assigned to the prior quarters, which is why you're only seeing this one little brown dot. We have a meeting with public health later this month to look at line by line. There are some areas that there is no revenue, which looks like it might be a billing issue. As you're aware, we have an accounting technician vacancy that has now been transitioned. So we're just going to look through each line to see, make sure we're on track, and take a look at what the differences are. Lastly, then, is going to be the out-of-home placement costs. This one has a new graph, net expenditures. There are 2 areas we get reimbursement for out-of-home placement costs, both our fees, which we're collecting from the parents, and our North Star assistance. So this particular graph takes those revenues out of the picture. You'll see that the expenditures for this quarter are just a hair above that, with an actual value of $539,000. Out-of-home placement expenditures really have been fairly stable over the last couple of years compared to some years before that where they were much higher. So this has been doing very well. That is everything that I have for you. Is there any questions that I can answer?
Mr. Chair?
Yes,
No, I would
Commissioner
just want
Glenn.
to thanks for the information. I want to thank you also for working with the administration department with the financials and stuff like that.
Oh, you're welcome. Thank you.
A lot of information.
Yep. Thanks, Christine. Last but not least, Executive Director comments.
Yes, and I actually have quite a few. The very first one is to respond to the question regarding the dosage, the total vaccines dosages. Was that Mike's question?
Yeah, that was Mike's question.
I'll wait for it to come back later. We can probably carry on with the proclamation then. We have a number of, if you could all stand up in our foster care licensing area. Stand up. Christine Treichler is the supervisor of this area, and we have a proclamation we would like the board to hear. And it is, May is Foster Care Month.
Thank you, Commissioners. I'm Christine Treichler. I supervise our licensing and therapeutic services team, and we have some of our foster care team here today, including our recruiter as well as our relative foster care licensors. Marissa, who's our primary non-relative licensor, had to duck out. I think our proclamation this year really captures kind of the national focus on kinship foster care when relatives take in kids. And then I think it also this year, our proclamation captures kind of our focus on empowering the families that kids have maybe been removed from and our focus on helping to reunify. So whereas strengthening families and focusing on their well-being is vital to building strong communities and preserving families is the primary goal of the child welfare system. Whereas all children deserve a stable, supportive, and loving home in which to grow, thrive, and realize their fullest potential. Whereas foster care plays a critical role in providing young people who have had to be removed from their homes a critical place of refuge. Whereas when children must be separated from their parents, kinship care provides children with the opportunity to grow and learn in a supportive, loving, safe home environment while retaining a sense of family, cultural heritage, and community ties. Whereas the dedicated individuals, families, professionals, faith-based and community organizations who support children in foster care help to maintain essential parent-child relationships and support parents who are working to regain custody of their children. Whereas we honor the selfless people who open their homes to nurture children and promote healing, reunification, and family-based empowerment. Whereas we encourage all citizens of Wright County to invest in the lives of children and to provide them with unconditional love, support, guidance, and every available resource to ensure their health and well-being. Whereas we acknowledge with gratitude the selfless citizens who open their hearts and homes to children in need and the organizations that tirelessly support foster and kinship caregivers. Whereas this month and every month, let us take the time to help children and youth in foster care and to recognize the commitment of those who touch their lives, particularly celebrating foster care providers.
Mr. Chair, I'll make a motion to accept the resolution regarding May as those adoption providers.
All right.
Foster care, sorry.
Motion
I'll
made,
second that.
motion seconded. Any further discussion?
They couldn't do their job without them.
No.
We appreciate all the work you guys do on that.
Yeah.
All right, roll call
Thank-
vote. Need a roll call vote on that?
Yep.
Resolution. Commissioner Deline?
Aye.
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 Aye. Motion carries unanimous.
Thank you, and this is later in my director's comments, but I'll move it up till now, that Wright County is number 5 in the state for relative care placements in 2021. We've got a way to go team from the state on here. And that they're saying, keep up the excellent work. In the 2021 relative placements performance, Wright County was at 78.3% for 92 children. Really amazing. Of the other counties that were ahead of us, the number of kids they placed, one was 5, one was 6, one was 26, and one was 10. So we're doing a really good job with a really high number of kids. So you guys do fantastic work. Thank you. And then the question asked earlier regarding vaccine doses in Wright County. And now remember that this does not include kids younger than 5, and this includes the multiple doses that people, vaccines that they can get. So to date, or I'm sorry, in 2021, 196,263 total doses were administered.
And that's through the doctor's offices and everything.
Pharmacies, yep.
Okay, thank you.
This is just a reminder, we had asked to do an all-staff training, and we were going to do it in March, but these rooms weren't quite ready yet, so we have this rescheduled for June 21st. So I believe that is a Tuesday. We'll start after the board meeting is over, but you might see some activity over here on June 21st as we get things ready for our all-staff training day.
Okay.
You know, that brings up a good point. We don't have a curtain inside there at all, do we? So that if somebody wanted to use that and there's something going on in here, should be something we should think about maybe.
Well, you're looking that way. It's not distracting for me because we're all looking this way, but yeah, they're going to see.
Well, there's another partition room
Right,
behind that, isn't there?
There's 2 more rooms.
Yeah, but they're gonna need all of it.
Oh,
We'll need all of it.
okay.
Yep.
They have a couple employees.
A couple hundred.
Couple.
I also wanted to direct your attention to our cash and SNAP performance report. So we get these, and if you look at page 9, I don't know if you've got it in front of you there. And this is something I think also that Commissioner DeLayden has been particularly interested in, but it's a percent of expedited SNAP applications processed within 1 business day. We went back and forth with the state quite a bit about what do we mean by 1 business day? Is it 24 hours? Is it the day that they come in? In any event, and I'm not even sure if that's related to our numbers here, but I wanted to congratulate Kim and her group. We are at, if I'm reading this right, 78.1%. Back in 2017, it was in the 50%, and that's well above the state performance measure, which is 55%. So really improved on that performance area.
Great job.
Good work.
Did we ever get an answer?
No.
Oh, okay.
And I continue to bring it up. Get a chance to open.
Because the one gentleman I talked with said, no, it's 24 hours.
It is, because their computer can't recognize the hours.
Yeah.
Here's a pertinent bit of information for this stuff. It was amazing that we were able to continue this because during COVID, a lot of the counties couldn't meet their expedited
You should step
requirements.
at the microphone because it's being recorded.
They really.
Kim, maybe, you want to step up by the microphone since it's recording? Thank you.
And you do have important things to say.
Well, it was just a little bit amazing that we were able to have such wonderful numbers because during COVID, many counties had to change their process. Many people were working from home and their processes didn't allow to meet the requirement of even the 55%. So there are many counties that were unable to do that. But we were able to make a quick change and do what we needed to do to get those expedites done in time. So that was very exciting.
Good job. It's too bad we can't get the state for them to figure out what 24-hour means.
I'm still looking.
Or if they would just tell us. We don't care what it is. If they would just tell us, then we're happy.
Yeah.
The next one is just an item. It's not generated by my department. It's the 2022 county health rankings for the 87 ranked counties in Minnesota. However, I think it is tangential to the work that I would say, I was thinking public health, but even Kim's staff, making sure people have healthcare available to them, social services being out in people's homes, public health for the work they do. So in the overall rankings, Wright County is number 3 out of 87 counties for good health outcomes, and number 4 out of 87 counties for health factors. And you have a whole listing of different information in this link that was provided to you. So I think we look pretty good as far as being a healthy place to live in Wright County, or in Minnesota.
Absolutely.
Yay.
Good job by all of you. Thank you.
I also wanted to let you know that I've been working with, Lee, and he's been very supportive in helping us with our min-choice wait list. We don't want to have a min-choice wait list, but we have had one for a number of months now, probably 9 months at least. And we were upwards of about 100 people, and because of things which is really not a healthy way to be in Wright County, because we want to make sure that people get the services when they need them. And usually by the time they're coming in the door for min-choice, it's after the families kind of realize we have a problem here. So we don't want these things, to be kind of hanging out there for a long time. Jill and Leanne and Rochelle and Nessa and everybody was able to get these down, where I heard that we were at 15 people on the wait list. So much, much better. So very excited about that. So good job to those folks.
Yeah, thank you.
I have a note here about the rent, Minnesota rent help, and I don't see it in front of me, but I do recall looking at it that I believe this is that Minnesota, I think with CARES money, they had set up a way for Minnesotans to get access to help with their rent and their things they needed during COVID when they were facing joblessness or had lost jobs. And I think there was over 1,000 applications coming from Wright County with over about $5 million awarded. So this is a discussion we had quite a while ago, just so you board are aware of the fact that $5 million in rent help went out to people in Wright County.
And I was reading an article, I think yesterday. There's still some money available. It might be in a different source now, but there's still money available for renters.
Right, I think it's still out there. I wanted to thank Court Services. They're not here, but I will let them know that a big thank you. If you remember a few months back, we severed our relationship with Total Compliance Solutions for our random drug testing. We've since now started a new contract with Minnesota Monitoring to do our court-ordered drug testing. However, Court Services stepped in a pinch, and we referred 10 individuals to them. They did 38 UAs, and they had 63 no-shows. And the charge to us was $760. So really nice that they were, and I know they don't have the capacity to do that long-term, but we really appreciate the fact that they were able to step in and help us out. There's a letter of support in your packet, and unless I hear otherwise, I'll assume that the board is in support of my signing this and sending this out to the collaborative that we're part of. So just kind of check the boxes here that we're continuing with our work with the collaborative, and the letter of support will go out after today's meeting. And I think there was something else, and hold on 1 second, let me take a look at here's the rent. Yeah, 1,059 people, and we're right in line with other counties our size for the Rent Help Me area. And I think that is all I have. So thank you. Oh, one more thing.
Now I'm standing up here. The opioid bill passed the House on Friday, so it's going to the governor's desk to sign. The settlement is $75, which is what the counties were advocating for, and it maintains the fee structure so that child protection funds continue till 2031 at minimum.
Good news all around. Thank you, board.
Thank you.
Thank you.
Is that all for today?
And I release you all.
Anything else to come before the board for the Health and Human Services Board? If not, motion to adjourn, 3:09. Thank you.